Namaste. Welcome to Dr. B.R. Ambedkar Open University. This is Dr. Srikanth Vodnala, MBA in Healthcare Management, Doctorate in Management Studies and Executive MBA from IIM Bangalore, currently serving at TX Hospital as Group Chief Operating Officer. Let us talk about today regarding the OPD and daycare services, how it actually helps a healthcare management student in understanding the planning and the structure and the scope, the concepts in OPD and daycare services. So, let us get into the topic, how and what are the concepts and scopes in daycare and OPD services. Basically, the outpatient departments plays a pivotal role for any healthcare organization, because the 70 to 80% of the patient interactions happens in OPD department. As the patient comes in, as the community comes in, OPD plays as a gateway to enter into the hospital. Therefore, making the relevant required things at OPD is very much important. And with the increasing technology, with the increasing clinical efficiency, some of the complex surgeries are turning into the daycare procedures. So, giving the seamless experience, clinical efficient outcomes in daycare procedures, therefore, which is very much important in today's era. The whole daycare procedures and the spectrum of daycare section. So, they represent the first and the frequent patient contact, and these services actually influence the hospital image, and it actually builds the trust, as most of the patients interacting initially at the OPD, which is essential for us to understand, and the planning should be in such a way which should efficiently increase and improve the healthcare delivery, and which will determine the overall performance of the. Why it is so important of talking about OPD services? As I said, it is a gateway to the hospital admissions, and most inpatient cases origins from the outpatient department. And so, it is essential for any healthcare organization to understand the outpatient department volumes, which drives the hospital in terms of numbers, in terms of revenue, in terms of growth. Therefore, it is essential to take care the outpatient department complex processes. Most of the in today's era, patients do not like to wait for any services. If somebody is in outpatient department, if somebody is waiting more than 45 minutes, which means regardless of the clinical efficient care, they are dissatisfied. Understand the importance of the OPD, and therefore, you make in such a way the waiting time aspects are controlled in order to get the patient satisfaction, which should not only make the patient happy, you should also ensure your own stakeholder like doctor, and you should create the atmosphere in such a way your own doctor time is efficiently used and the productivity is utilized for the better patient care. The strong OPD builds hospital reputation. So, in order to make the planning of the OPD, what are the objectives that we are supposed to consider, and which should ensure the smooth patient movement, and definitely which should reduce the waiting period at every phase and improve the consultation effectiveness, which internally should also optimally use your own resources, be it front office, billing, clinical nursing staff at the vital check, or any other technicians at the different diagnostic setups. So, you should able to optimally utilize your own resources. Therefore, you will definitely enhance the patient comfort, and you should also see the privacy part of the patient in OPD areas or in consultation areas, and which should definitely support the quality and service at delivery. In order to achieve all these things, how your OPD should be located within your hospital? The most importantly and mostly, the OPD should be easily accessible, and it is ideal to have at the entrance, and the emergency should be dealt separately. Your emergency should have its own entry, your IPDs can be can be taken in a separate way, but OPD should be given the utmost important, the close linkage with the diagnostics. The reason we are talking about is so the internal patient movement experience should be better, right from the registration to all the processes. The internal movement across the department should be improve the convenience and the patient flow. So, how the layout planning and what are the consideration to be taken during the layout of the OPD. So, the logical flow, we discussed about the logical flow of the functional aspect of the patient. As the patient goes, let us say the registration is at the first, and that is the first contact point, and wherein during the peak time that we should able to have the more and more queue, more and more registration desk in place, and once the registration is done, then it will be moved to the vital check part or the pre-assessment area or the consultations, and then we moves to the investigation part, then I will again come back to the same consultation part. So, it should be arranged systematically, so that the patient should not be feel is lost somewhere. Your layout planning should in such a way the sequence of activities are considered during the planning itself, and adequate waiting space, and this is the current ongoing problem in any healthcare setup. While making the planning, they do not keep the adequate waiting space. Therefore, there is during the peak hours, especially during the peak hours, the crowded patient attendant, they do not like to cross traffic with some other patient attendant. Therefore, it actually gives the dissatisfaction, which ends up with the negative impact on the overall aspect. So, your design should improve the operational efficiency across the OPD departments. And how the patient flow should be designed in OPD. As I already said, you start with the registration, the first impression is the best impression, and then move to the many other sequential activities as we mentioned in the diagnostics, review, follow-ups, advice, and they will come back to the billing, they will go to the pharmacy, take the medicine and exit. So, the flow should be in a place as we discussed. So, registration and reception planning. So, the OPD, the control point should act like should actually sorry. So, how the registration and the reception should be planned. So, the OPD should act like a control point, and as I said, it is the first impression at the hospital. We should have adequate counters and we should reduce the queue. Most of the hospital, they fail to they keep the same manpower across the day. So, there is a peak hour in the morning, peak hour in the evening. Your staffing should be adequately placed based on the need, not always with the static number. And with the current increasing technology, the queue management systems are needed, and which will not only manage the queue, which will also gives the patient continuous communication without talking to the receptionist or maybe some of the representatives. Patient should able to know where is he, what is his number, and when is he going to meet the doctor, and which will also collect the accurate data, which is essential for us to understand. So, to achieve the smart OPD operations, the registration and the reception planning is very much needed. So, waiting areas which is most under prioritized in most of the facility planning. The capacity should be based on the patient peak load, not on the average anytime, and it should always have comfortable seating environment with a good ventilation and lighting. So, your information should always displays, which should reduce the anxiety, the separate areas for special clinics, regular clinics, super specialist clinic. So, the segregation should be in such a way that the type of patients are also segregated and sent to the respective areas, and which should definitely avoid the overcrowding at any given situation, and that is how your design should be in a place. So, how your consultation room should be planned, definitely it should have the privacy and respect the dignity of the patient, should have adequate space for the interaction. Most of the time patient do not tell the clinical history because of the privacy, and they also feel that there is no proper sound control or confidentiality. Therefore, patient not able to tell his own history, your diagnosis part is missing, therefore definitely it will have its own implications in patient better outcomes. So everything should be taken care, your proper lighting, ventilation, hand washing area, wheelchair access to the room, sound control for the confidentiality, and should support the effective consultation. So therefore, which is the OPD consultation room plays a major role for OPD patient. The role of diagnostic services in OPD: diagnostics are the heart of the hospital, and any patient comes, the treatment gets completed only with the proper diagnostics. So the close proximity actually reduces the patient movement. Having located the diagnostic also in same floor, let us say once the consultation is done, then immediately move to the diagnostics in the same floor with the minimal support staff, and with the clear guidelines, with the clear signages, with the clear directional boards to the diagnostics, not only minimizes the patient anxiety, it actually reduces your manpower cost as well. Patient himself getting educated and is moving to the required places. So and so it also delays in turnaround time, and we will also get a proper treatment plan, effective treatment plan within expected timeline, and it definitely improves the overall OPD services when it is integrated within the same system. So your staffing pattern, we are talking about OPD. So there is a set of doctors, set of nurses, set of support staff, and it should be based on the patient load, should never consider on the static mode. Usually in the peak hours, when the patient load increases, most of the setups do continue with the same load regardless of the patient. That is where the peak hour crowd and the arguments at the reception, understanding differences at the reception, all these things will happen. You should also manage the crowd and increase the staff based on the patient load during the peak hours. And your front desk staff definitely requires soft skills to handle and mitigate regular and conflicts with the patients as well. So efficient staffing improves overall outcome and the satisfaction in the OPD department. So appointment and scheduling systems, with the increasing technology in today's era, in every hospital, whether it is small or big, primary, secondary, tertiary, quaternary, every hospital more or less they have the appointment management system. But in my view, that I would say, having a rigid appointment system may not suffice. You should have a hybrid model, because not every patient comes with the elective mode on appointment. There are certain people comes and a walk-in, and of course emergencies are dealt in a separate way. So your system should enable and satisfy both walk-ins and as well as the scheduled appointment patients. Therefore, you will reduce the proper appointment schedule system will reduce the overcrowding, and it balances between the walk-ins and appointments, and which should definitely improve your doctor utilization, and the waiting periods at the different place should also come down with the use of technology, and which needs to be continuously monitored by the respective team members. So let us also look into some of the concepts of daycare procedures with the increasing technology, with the clinical effectiveness. So usually this short duration treatment plans comes under the daycare. So there is no overnight stay, and which actually enable same day procedure and reduce the inpatient, and of course it actually reduce the inpatient bed occupancy, cost effective care model, improves hospital efficiency. So without disturbing your inpatient beds, you making the high turnover around, because you are able to treat more and more patients. So if you can understand some of the daycare procedures, so there could be a minor surgical procedures, maybe a small abscess removal or drainage system, or maybe a small cyst removal, or endoscopy, colonoscopy, daycare chemotherapy, dialysis, observation for a small thing. So All these things, some of the daycare procedures which can be discharged on same day. So, and then having understood about OPD and daycare services, how we should plan and the layout of the daycare unit. As I said, the OPDs should be near, or the daycare should be near to the OPD and operation theatre, separate from the inpatient ward and comfortable for the recovery areas. So, should also have its own monitoring system, should also have medical supplies, should also have continuous monitoring system, should also have its own facilities and minimal patient flow. So, safety and efficiency should be prioritized in daycare, because you never know which patient turns into the complicated and immediately rush into the critical care support. So, it is essential to keep the proper manpower, adequate infrastructure, taking care of all other requirements in daycare is very much needed. So, what are the advantages of daycare services? Because which actually reduces the hospital stay. They come in the morning and they leave by the evening, which definitely reduces the cost to the patients, and faster patient turnover. So, better bed utilization, and which definitely improve the patient satisfaction. Operationally also you save a lot of the cost. There are advantages in daycare, there are disadvantages, or maybe I would say the challenges in daycare. Since the volume is high, so there are high chances that the crowd traffic or overcrowded may lead to the different argument segments or different some other difficulties. So, and if you are not able to manage the waiting period, there are high chances that patient get dissatisfied, and since there is a high volume of patients, so the staff coordination also becomes a little difficult during the peak hours, and the space constraints, rising the patient expectations. So, these days patients alone not just expecting the clinical care, they are also expecting other ambience, aesthetic, and other more advanced and more experience related things. So, which internally make us to work challenging way to make them happy, and which definitely requires a continuous improvement. It is quality and safety, it is a continuous process, it cannot be achieved overnight, and it is not a one time destination. So, which is a continuous journey to achieve the patient satisfactions. So, having said the concepts and the layouts, designs, so what are the quality indicators in OPD and daycare? So, we said that most of the patients, they experience their services, their interactions are high in OPD segment. Therefore, naturally it is important for us to understand how patient is happy in OPD. And one of the biggest, as I said earlier, if someone is waiting more than 45 minutes in OPD, which means they are dissatisfied regardless of the efficient clinical care. So, the waiting period are very much indeed the quality indicator which we are supposed to understand as a hospital administration, and the satisfaction score, which internally helps not only just in terms of the turnaround time, which may be the behavior from the entry, security to the different stakeholders, because healthcare is a complex process, involves numerous stakeholders. Let us say if you are talking about a commercial building of a 5-floor building, which is equivalent to the 100 bed or 200 bed hospital, you may able to see 50-100 staff, but when it comes to the 200 bed hospital, same 200 bedded similar kind of setup, you will see more than 600-700. So, since the process is so challenging, which requires continuous coordination, communication among the healthcare worker, there are high chances that the communication may get failed, which internally compromise the clinical outcome. Therefore, the satisfaction score, understanding their feedback is very much essential, and your consultation duration, procedure, if there is any procedure in OPD, the turnaround time for the procedure, pre-procedure, post-procedure, your infection control, compliances, and service efficiency metrics, every much these all indicators are needed to understand the OPD and daycare set of patients. Usually most of the people, they do simple planning mistakes. So the patient flow, understanding differences in patient flow, and keeping inadequate waiting areas, weak diagnostic integrations, which means there is no a proper communication system from the clinical side, from the doctor to the diagnostic role, the diagnosis setup to the patient. So there should be the integrated system which should communicate every aspect of the clinical things actually. So therefore the integrating all the services are very much needed, and sometimes what happens, overbooking appointments, which gives again in terms of overcrowded, dissatisfaction, and staff shortage during peak hours, so leads to the dissatisfaction of the patient. We should always avoid these kind of simple mistakes and can have better patient experiences. So in a way, to summarize what OPD and daycare services does, OPD is a performance driver, and daycare reflects the modern care delivery system, and both will have its own the quality impact and the revenue generating model, high patient, because that is where you get to see more walk-ins, the community gets into the hospital, and you are able to reach to the maximum people, and maximum people are visiting your hospital in the OPD section only. So therefore it is very much essential for an hospital administrator to understand these aspects, and so therefore your planning should be so efficient where you reduce the stress to the patients, and should always support and aim for the sustainability. As I said earlier, this is not a one time job, it is a continuous job, and your critical for the hospital success lies in OPD and daycare systems, daycare services only predominantly. So as a hospital administrator student, it is very much indeed that you learn the concepts and the services in the daycare system, how strategically we utilize our OPD services, daycare services, and the objectives which are involved in OPD planning, as we discussed, smooth patient movement, we should reduce the waiting time, improve the consultant doctor utilization time, and other manpower utilization, and we should enhance the patient comfort. The privacy plays a predominant role in the OPD segment, like the location within the OPD department, and the integrating diagnostic and other supportive for the OPD patients. All the services indeed help the patient to have satisfaction levels, and in recent days that hospitals started using net promoter score, where the patient is not talking about the basic satisfaction, they are expecting the experiences. Since the service industry is growing, so no more hospital as a hospital for a basic services, not only just the clinical care, they are also expecting the ambience, they are also expecting the aesthetics. So when apart from the critical care, it is very much needed in today's era to take care of the aesthetics part, but aesthetics are the outcome, how beautifully that you display, but without having a proper layout which supports your process in place, your patient moves in place, and therefore it is essential while planning you should involve your all stakeholders, the concerned stakeholders into the discussion, take their inputs, make the process, then make the layout and design, then aesthetics comes into the picture. So the patient be it a registration concept, registration, have adequate registration counters, take care especially during the peak hours, should have a dedicated people who handles the patient grievances. You should have a dedicated team to support the interdepartmental coordination. Doing one task, one set of people always gives clarity. So multitasking may compromise the patient satisfaction. Should able to identify the team, we should able to train them for the job which they are doing, so that there is a clarity and the patient travel with them, and therefore will have dedicated roles, dedicated employees, the patient experience seamless from the entry to the exit. And we also talked about the consultation room planning, how it should be. As I said, there are enough studies, the clinical outcomes are not expected, the clinical outcomes did not come as expected because patient did not disclose all the clinical findings. The reason is they felt that the room is not good enough to maintain the confidentiality. The sound control is not for the confidentiality. Therefore, the patient did not disclose all their problem, which did not help the doctor to understand the diagnosis. Therefore, there are high chances that they will end up in clinical discrepancies in terms of outcomes. So, everything plays a major role, and the role of diagnostic, we also understood about the role of diagnostics and how it is important to be in a proximity to reduce the patient movement, delays in effect treatment planning. Efficient diagnostic always improve the OPD flow. So, in today's time, most of the OPD flow increases with the word of mouth, and word of mouth comes with the satisfaction, and that is where now in time we are talking about net promoter score. So, net promoter score, which helps us to understand how happy they are at a different level of services, whether it is with the clinical team or non-clinical team or with the support team, gives overall understanding on the patient process and their understanding levels. So, our staffing pattern, how it is important, our appointment and scheduling, how it is maintained, and your daycare services. In a way, what we are trying to understand as a whole, if we can talk about from the entry to the exit. You know that OPD is the biggest area where you have the patient facing elements are in place. Therefore, you understood where is your high priority job. Ensure the required arrangements are taken place during the facility plan itself, so that the patient will not feel that they are missed in somewhere, and all processes are connected, interconnected with the diagnostics and respect to all places. Therefore, we are able to get the better patient satisfaction levels. If you need to conclude how OPD and daycare services, as OPD is the hospital performance driver, and we talked about it, how daycare influence your revenue markers. Both have got its own impact in terms of patient footfall and revenue. Therefore, it is essential to maintain the quality. So, the department should support for the long term sustainability, and it is very much critical for the hospital success. As a hospital administrator, your job is to bridge between the clinical team and the non-clinical team, make them together, work together, plan together. Therefore, you achieve the highest patient satisfaction levels. Thank you.